Hi, Dr. Del Grosso, SF Chiropractic. I just spoke to you briefly about herniations and disc injury, so let's talk a little bit about decompression and what decompression is. You hear it a lot, not everybody understands it. Basically, decompression is traction, is a type of traction. Years ago, we used to just do what we'd call axial traction, and the traction would be to take the pressure off the disc, to relieve the pressure on the disc a little bit, to allow things to settle down, to allow the nerve to settle down a little bit, be less inflamed, and try to help with the symptoms, but it really didn't change the problem. And today we've developed what we call decompression. And basically decompression is just like it sounds, we're decompressing the disc. The way it works is it's an axial traction, but it's a traction that's a controlled traction, and it's a control and release type traction. The idea of it is we traction, we pull at a certain amount of pressure, and then we release, and then we pull again at a little more pressure. And the machine that does the decompression is the one that regulates and controls that. And the simplest way to put it is if you take your hand, put your two palms together, and you squeeze and do this, it forms a vacuum inside the palm of your hand. Basically, that's what decompression is all about. The idea is that controlled pull and release, pull and release, pull and release is designed to form a vacuum inside that disc where that soft center is and try to draw some of that disc material back in the disc. Decompression can be very effective. The secret to decompression, to be honest with you, is you have to follow through with it. You have to stick to the regimen, you have to do it, you have to do the exercise, the things that go along with it, and usually you get pretty good success with it. If you don't follow the protocols and you don't do it the right way, you're not going to be happy and you're not going to have the success you should. But the bottom line is, if you have a disc injury, a disc problem or something, probably the first line of defense or the first line of treatment to try to help with it, to me, would be decompression, okay, before you get into any other kind of more invasive type things. All right, so that's a little bit about decompression. You have a great afternoon, and I'll speak to you soon. Again, it's Dr. Del Grosso.